In tonight's Health Watch, a frightening statistic. Tens of thousands of people die of heart disease each year, and they never saw it coming.
And making matters worse, it is rare for someone to survive a sudden cardiac arrest. CBS 2's Dr. Max Gomez here now to explain.
That's right, and this gets very confusing very quickly because people tend to be a little imprecise with their terminology. There's heart attack, there's cardiac arrest, there's sudden cardiac death, and other combinations of those terms. And some of these conditions can lead to others, but it's rare but not impossible to survive sudden death syndrome.
Hugging it out. Pleasure to meet you.
4 years after nearly losing his life, Ed Jean-Louis is at last meeting the women who saved him.
Happy to meet you both and be able to thank you both.
Ed was a 27-year-old grad student at UCLA playing basketball when he suddenly felt ill.
I remember saying, I feel lightheaded, like right before losing consciousness.
Doctors say Ed was a victim of sudden death syndrome, a condition that causes an abrupt and unexpected cardiac arrest in people who are otherwise healthy. Most cases occur when the electrical system of the heart is not working properly.
We were trained. We knew what to do. We were prepared.
Emily Duncan and Christine Fry were working at the rec center when Ed collapsed and were among 3 employees who rushed in to help. They grabbed this defibrillator just outside the basketball court.
We put it on him, and it said to begin CPR. And so that's when we started the CPR process.
Their quick action helped save Ed's life. But he's the exception. Sudden death syndrome kills more than 200,000 Americans every year, and it's the leading cause of death in young athletes. Ed now has a small defibrillator implanted like this that can shock his heart back to normal rhythm if he has another lethal arrhythmia.
I don't want to get too emotional, but I appreciate you both. Try to be grateful, try to be present and appreciative of kind of every breath, right?
Now, sometimes a person will have some heart symptoms before it becomes sudden death syndrome. Often there's no warning sign at all. Those life-saving defibrillators are mandated, by the way, by New York law to be in all public schools, state buildings, health clubs, and in all first responder vehicles. And because often there's no real warning sign, the best thing you can do is follow those healthy habits, exercise, keep your weight down, make sure your blood pressure is down, your cholesterol is down.
Wow.
That's really scary. I'm like listening to this and I'm like trying to have it digest, and it's like no warning signs whatsoever, and it just happens like that.
Often that's the case, no warning signs. Now, they may have had some risk factors. They may have been overweight or had their high blood pressure a little high.
You don't feel like the chest pain or the pain in your arms or anything like that.
No. Last second, he just blacked out.
Boom.
Wow. All right. Thank you, Doctor.
Thank you, Dr. Max.